made it look a lot nicer, but this is a copy and paste from my documentation within the Epic medical healthcare record, right? Where I literally pull up these charts and I'll calculate it one time point, and then I'll hit like, I don't know, insert rows, and I'll track these, what I call key functional indicators, right? So the business people have their KPIs and I have my KFIs, my key functional indicators that I track over time of what I need a shoulder to be able to do in order for it to determine its current status. And so as we go through this, again, I've done the hyperlinking where I deemed appropriate. And what we're going to do right now is we're going to go through our mobility assessment. And it's a sequential means that how have I stumbled on this sequence? I haven't seen anyone use the same sequence that I have. It just it flows really well in clinic and allows me to be really efficient and effective to get all the information in the shortest amount of time as possible. And the other thing that I see in clinical practice is that we can measure a whole bunch of different things, but we would be much better at identifying like what are the key important metrics to measure, and doing that very well. Because this is kind of extensive, and it used to be a lot more. And I realized that I'm getting people better, and I'm not looking at that anymore, and that has fallen away. But I wouldn't know until I cast the vast net and identify what is important. And so there's probably other things that I'm also interested in having those conversations where others also share what they look at that is different than this. And I have many thoughts and only one mouth, and so I started a moment ago in saying that we're going to do something different, and we are. And so I'm gonna ask you to clear off your tables, because I'm gonna show and tell for about 3 minutes a technique, but simultaneously I want you to, almost like a monkey see, monkey do, rather than doing 5 or 6 assessments and having you break out, which can kind of double our time. We're going to do like 1 or 2 assessments, and your patient is already going to be there. So one of the things that I use in my clinic is for patches. We're going to look at passive range of motion, as I call it. Is I use a dowel or a stick. I collected, I don't know, a couple of them. There's a big bin just back there. If it's okay, Kristen, if we use. Yeah.
Absolutely.
Thanks for, I asked for forgiveness rather than permission. But grab one of them as needed. I have a couple that I can pass out here, and then we'll go from there.